And if you can, yeah.
Yes, Dr. Iggy.
Okay, then let me see if I can share.
Yeah, I allow sharing.
All right, and let's jump right into it. So today we want to talk about exosomes and their potential for hair restoration. And leading into this, we want to talk a little bit about um, the causes and the traditional treatments. So, as you just said, I mean, the prevalence for hair loss is extreme. As you can see here, there's an estimate of 70% of all men and 50% of all women over the age of 50 are affected by hair loss for some reasons. So that's a staggering number of people that are affected by it. And this is not just a cosmetic problem, but it is also a psychological issue that is at least perceived as diminishing the quality of life. So the prevalence and the gravity of this condition is definitely something that has to be observed. Um, I gave here an interesting reference that talks about it, and I'm happy to send everybody the slides upon request. The main causes for alopecia, hair loss, are androgenetic alopecia, which is the primary cause, as it accounts for the majority of all cases. It's hair loss driven by genetic or hormonal issues, and um, it's commonly known as thinning of hair in women and hair loss, completely hair loss, bald spots in men. Then there's alopecia areata. That's autoimmune form of hair loss. It consists of bald, patchy spots, and it's less common, but it is relatively prevalent. As you see here, other factors are stress, nutritional deficiency, and hormonal imbalances that can cause hair loss, and that actually feeds into alopecia areata. As especially stress by itself can cause, the loss of hair. On the left, there's a table with some overview of what can cause or contribute to hair loss issues. And again, please ping me after the webinar. I'm happy to send you my slides because I appreciate that's often a lot of information to be conveyed. Yeah, as mentioned before, it's not only a cosmetic issue, it is a psychological issue. Hair loss does have an emotional impact for most people. They, you know, perceive as a full head of hair is a sign of youth, and when you start losing it, you're losing your youth, which is not far from the truth, but it's certainly something that nobody can be happy about. And in extreme cases, it can lead to diminished self-esteem and even anxiety to perform in social circles. It can even result in depression in some people. So definitely what most patients report is that they are feeling older and less attractive than they used to. And that is not something that anybody would enjoy, obviously. Um, Interestingly, like this issue of like being emotionally affected by it can cause some stress or depression, which by itself can further complicate things and actually accelerate these kinds of hair loss issues. So it's not just about vanity when we talk about hair restoration, but it's about restoring confidence and normalcy, and like a higher degree of self-esteem. Um, a brief overview of traditional hair restoration methods. There's obviously the classic topical oral medications like Rogaine, etc. And they do have an effect as they help enlarge follicles and prolong hair growth phases and So you will see some beneficial effect using these kinds of medications. The downside is that they require daily use indefinitely, so you can never go back, or else you will lose your benefits. There's low-level laser therapy that has been around for a while. Again, has some modest effects, but the outcomes are really gradual and modest, and it is not what it promised to be. PRP is widely used and with good results in most people. The problem with PRP is that you're relying on the quality of your PRP product. It's also invasive, it's time consuming. The practice or the med spa has to be equipped accordingly. And the PRP quality is not always what you hope it to be. And you have to also continue these kinds of treatments on a regular basis, or else you go back to what it was before the PRP injections. Then, of course, there's hair transplant surgery, which is very effective, but extremely invasive. It's quite costly. And then it's a matter of the hair availability that any given donor or patient has. And I personally find it like a very gruesome form of therapy that does work, but I used to say it's better than nothing, but there are things that are better than this, and I come to that very shortly. So the limitations of conventional treatments is really modest results. It might take a long time to actually notice any significant changes and improvements. It might be only incremental, and most options really do not restore, the youthful head of hair that you are hoping for. Um, then side effects, especially with things like Rogaine and finasteride, they have hormonal effects. They can cause other side effects, so that a lot of patients actually start using it and then discontinue for these reasons. So it's definitely not ideal. And that makes it a problem because unless you adhere indefinitely and long term to these kinds of treatments, you only have a temporary effect, and then it will go back to the problematic stage. Then for certain applications or options, you have the invasiveness and the downtime that comes with it. You might have to abide by multiple needle sessions for PRP treatments, for example, etc. So overall, I would argue that the expectations that we have are not always met by these kinds of conventional treatments. And again, I think there is something better on the horizon. And what could be better in this context is exosomes. That I consider a breakthrough approach. So exosomes have been around for a while now. I think it's fair to say that they are like the hottest topic in the field of rejuvenation, and that includes hair restoration as well. And I don't want to get into detail about what exosomes are. If you want to know more about this, I'm happy to provide you with certain white papers and additional information. And again, just ping me. Exosomes are tiny little vesicles that are secreted by almost all cells. And they are the experts in cell messaging, so cell-to-cell communication. And as such, they contain a lot of functional proteins such as growth factors and cytokines, and also the genetic signals that can trigger or amplify regeneration and tissue repair. So you will be able, by utilizing exosomes, to tackle the problem at the root of it, at the hair follicle, at the cellular level. And they are the nature's regenerators, especially when derived from stem cells, as stem cells, as we know, are the building blocks of life. So they contain a very potent cocktail of signals and factors that stimulate regeneration, and they are able to reboot and reprogram weakened cells or dormant senescent hair follicles, for instance, and ramp them up again. And it is truly rejuvenation, as I will show you in a few slides with some before and after pictures that prove the point. And this is a paradigm shift. So rather than a palliative treatment that most of the conventional treatments are, using drugs or hormones and so on, they can only trigger, a certain temporary biological response, but they typically do not tackle the root cause of hair loss, which lies in senescent hair follicles or otherwise damaged and weakened cells. So only exosomes really have the potential to tackle that part. Here's a little bit, it's a little bit wordy, and again, I'm happy to send you my slides, so I don't want to get in too much detail, but it is important to notice that there are certain factors that benefit hair growth, and this is what we are hoping to find in our exosomes. And it's just a melange of things. It's not just one factor, or let's say in PRP, for instance, you find like typically 5 to 15 growth factors. In potent exosomes, you find all 50. So there are about 50 growth factors that are known currently, and all of them are represented in potent and bioactive exosomes. So one of the types of growth factors are the EGFs. It's like a whole list of them, and they stimulate cell growth and proliferation, and therefore play a role in follicle development. And they can also reboot the hair follicle once it becomes senescent, aged, or dormant. Insulin-like growth factors, or IGFs, IGF-1 is a very potent growth factor that has a lot of applications in regenerative medicine, and it's also a key growth factor that's involved in hair follicle growth and cycling. So it's a very important factor indeed. You want to make sure that you actually find this in your exosomes. On that note, I want to give a shout out for the mass spectrometry analysis of our own H0 exosomes that was performed by Dr. Carla Mazzeo. Carla is a capacity in her field. She is working on exosomes for more than 20 years. So she was a very early adopter of that scientific field and has a wealth of knowledge. And she is currently leading the Exact Oversight Bureau that aims to establish standards and weed out certain bad players that are unfortunately very prevalent in the market. So she is also, a wealth of knowledge. And if you want me to get you in touch with her for further insights in exosome biogenesis and in science, I'd be happy to make an introduction. We have the FGFs. It's another family of growth factors that is also involved in a wide range of processes. And just as IGF-1, it's important in certain aspects of hair growth and regrowth and stimulation of epithelial cell and the formation of the hair shaft. VEGF is another signaling protein that is primarily known in its role in angiogenesis, and that is, of course, equally important because only a healthy scalp will be able to maintain healthy hair follicles. So angiogenesis, so the building of new blood vessels or the rebuilding of blood vessels once they're lost, is a crucial thing and will promote the hair growth that we hope to see. Wind signaling molecules, it's getting very sciencey. The wind signaling pathway is one signal transduction pathway that is very important in a wide range of aspects and applications, but it has a particular and essential role for hair follicle development and cycling, and therefore is needed for any regeneration of these hair follicles. And then we have HGF, hepatocyte growth factor, is one of the most well-known and well-studied growth factors. Again, stimulates cell proliferation and morphogenesis and also stimulates hair growth, and might be able to extend the growth cycle for hair. Then finally, SCF, stem cell factor, is a cytokine. It's actually not a growth factor per se, but it also plays a crucial role in the survival and proliferation and differentiation of certain kinds of stem cells that in turn have a huge benefit when it comes to hair growth and regrowth, as well as pigmentation. So I will show you a picture in a little bit. When we talk about pigmentation, it's not only thinning hair or the loss of hair, it's also the graying hair that bothers some people. And exosomes have the potential to address that problem as well. So in conclusion, exosomes contain a whole list of bioactive molecules that are important for a healthy hair growth cycle. And they have all the building blocks and the instructions, genetic instructions for hair follicles and scalp cells, epithelial cells to reboot and revamp, to get reprogrammed and return to a more youthful state, all of which will then support the regrowth of hair. I want to mention this only on the side. In order for exosomes to really render that benefit, it is important to make sure that you have a bioactive and functional exosomes. So the way the exosomes work, they are packed with all this cargo of growth factors, cytokines, other functional proteins, lipids, metabolites, and a wide range of RNAs. And all of them are to some degree or another important to fulfill their role in rebooting the cell, reprogramming the cell, and returning them to a more youthful state. So they can only do that when they are functionally intact. That means their integrity, their structural integrity is warranted, and they are what they are supposed to be. So you will find in the market a lot of products that are labeled as exosomes, and they are far from it. They might contain a few, but it's oftentimes just conditioned media that has a lot of junk in it. Or one of the most serious problems is lyophilized exosomes. If you freeze-dye your exosomes, you actually render them non-functional by destroying the bilipid outer layer. So you only have exosomal debris, but not a functional exosome. And that is required since the functional exosome, the intact one, can only fuse with a target cell and then introduce all their cargo. If the integrity is diminished or broken of that exosomes, then this can no longer happen. And then you have at most a temporary and very superficial benefit by some residual growth factors that might still be around. I'm happy to talk about it more, but we had this covered in previous webinars, and Dr. Haizam will be happy to actually provide you with a link to the recording of these webinars, or again, reach out to me and ping me about your interest at any time. This is just a addition to that side note. You see on the left a functional product, functional exosome that has this nice typical donut shape of around 100 nanometers. You see the corresponding nanoparticle analysis, tracking analysis that has like a nice dominant peak at around 100 nanometers, while you see two competitive products that are both lyophilized, and you don't find a single intact exosome. All you find are these protein aggregates, and you see in the nanoparticle analysis that the peaks, the corresponding peaks, are all over the place, but not at around 100 nanometers where they should be. So no exosomes there, therefore you cannot expect the same standards. This leads us to quality and subsequently also safety. Make sure that if you are interested in adopting exosomes in your practice and treat your patients, that your provider abides by applicable quality standards. We actually manufacture our exosomes according to FDA standards. They are medical grade and third-party tested by a certified CLIA lab for an unbiased evaluation of our products. And we find this of utmost importance because even if you only topically apply your exosomes, it's oftentimes in conjunction with microneedling, for instance, which you could describe as like perforating your skin, right? So your whole face just got damaged. And if you want to put anything on it, it better be medical grade and clean. And this way you can be sure of the application being safe as well. So that's why we find it important. Always ask for a certificate of analysis, ask for trans-electron microscopy data that confirms that there are actually intact exosomes in your exosome product, and ask for the nanoparticle analysis. If your provider cannot provide all of the above, I would stay clear of that particular provider. Our H0 exosomes actually abide by all of these standards and then some. And in addition to that, and that's why it's the only exosome that can be labeled as H0, we have a low passage protocol in place for the culturing of our stem cells that secrete those exosomes. That means that we only passage those cells 4 times, which is something that the International Society of Stem Cell Research once evaluated. If you have your stem cells and you pass them only 4 times, you can be 99.9% sure that the resulting cells are still identical with the cells that you harvested from the umbilical cord sword jelly. And this is the only cell that actually harnesses the full potential of H0, the youngest stem cell you can find. And these stem cells just finished building a baby. So they have the potential to develop tissues and to regenerate and repair and fix if there's any problem. If you go beyond those 4 passages, then you increase the risk of contamination, mutation even, and certainly differentiation. So those cells at some point will no longer be stem cells, and therefore the exosomes secreted by them also have a different role and potential. Now coming to hair restoration, last not least, I want to show you a few before and after pictures. And starting with this one, that was our patient zero, the husband of our CMO, and he noticed some thinning hair on top of his head, which is the upper picture. You also see he's in his mid-40s, dark hair. So you see the salt and pepper, which is typical for that age, as is the thinning. And then interestingly, after only one application of microneedling plus exosomes, you see that the hair is visibly denser, but overall also darker. And this is what I previously indicated constitutes some proof for serious rejuvenation. So not only that you reactivate the hair follicles again for more hair to grow, but it seems that even the pigmentation will return, gradually back to normal. So that was very exciting to see something like this. The thickness, the density, and the coloring all returned to a more youthful state after just one application. So there was a gentleman in his 40s, mid-40s. Here you have a gentleman in his mid-70s who has a bald spot for 30 plus years. He said that he doesn't remember that not being there. And he was intrigued, so he wanted to try it as well. Again, microneedling plus exosomes. And here we see the second picture, day 75. That was after 2 applications of microneedling exosomes. And you see a lot of hair growing in the center of the bald spot. But what is more intriguing is the size of the bald spot. So you see that the size of this bald spot dramatically shrunk, which is, again, a proof of serious rejuvenation, because the way a bald spot develops in men is typically thinning hair first, then a small bald spot, and then the bald spot starts growing. And applying exosomes here has the reverse effect. So you go backwards in time. The bald spot gets smaller, and more hair grows. So that was just exciting. And now a few other examples. 67-year-old with thinning hair was treated. This is 30 days apart after one treatment and notably with only 10 billion H0 exosomes. So the dosage of exosomes for hair restoration is still something that we further investigate. We have a number of clinical trials going on right now that wants to have a dose response assessment, aims to have a dose response assessment. It always looks more is better, but then again, if you use 100 billion exosomes, it is not 10 times better than 10 billion. So there is a price to benefit ratio. And I always argue, while more is better, you should rather go for frequency than for a high number of exosomes in one go to give you the maximum effect. Here's another example, some widow peaks treated with 10 billion exosomes. This, by the way, was done not with microneedling, but with a target cool, which is a CO2 gun, applying those exosomes. And that being said, the mode of application or the modality used in combination with exosomes it can vary. And we have seen a number of positive effects with a number of modalities. And one of our clinical trials is now aiming to assess the efficacy of just topical application and massaging in without any other means of preparing the scalp and see what the results will be there. Going to be very exciting, I'm sure, and we will present the data as soon as it becomes available. Here another one, this microneedling again, obviously thinning hair the lady suffered from, and this is only 5 billion H0 exosomes. It has to be noted though that it depends a little bit on the patient, the individual response to any given treatment. It also depends on the practitioner, how skilled they are in their applications. We have heard of cases where the results were underwhelming, and then it turned out that the practitioner was a little bit too radical with his microneedling and therefore inflicted more damage than the exosomes applied could rescue in that case. So that is something that our own Julie Gramick would be happy to assist with. I think she couldn't be with us today, otherwise she would have presented those pictures and tell you everything about it. But she's currently suffering from a pneumonia and therefore cannot present those data herself. A final picture of a gentleman also thinning hair, and after 2 treatments, you see this remarkable improvement of hair density. And again, it seems also the color returns. That being said, there is a tendency not only of more is better and higher frequency is always good, but it's also always age-related, which means our mid-40s gentleman on the first slide had a more immediate effect than, for instance, 75-year-old in the second slide, who needs a few more applications to actually turn back the clock. So I always say there's like a couple of years you can shave off with each application, and the older you are, the more applications you might need. And once you get the desired effect or result, then it's only about maintenance. So unlike things like Rogaine and so on that you have to take daily, an exosome treatment, you should probably opt for a couple of those within, a few weeks. And then after that, when you have a beneficial effect, you do maintenance like once or twice a year to maintain the results, as compared to Rogaine, that when you use them, you go back to zero. And that was all I wanted to present today. Please do contact us at resilier.com or at greatlookinc.com with any questions or requests you might have, and we'd be happy to be there for you. Thank you.
Thank you, Dr. Hickey, for the nice presentation about hair restoration. For now, we would like to allow doctors to ask any questions they need to ask and interact with us. Doctors, please feel free to ask any questions, or you can just unmute yourself and ask the question, or just write the question in the chat group, and then Dr. Hiki can reply.
Looks like everything was abundantly clear today. Happy to hear it.
Hello.
Yeah, we can hear you.
Can you hear me?
Yeah, we can hear you now.
Hi, good evening. This is Dr. Sezgin from Dubai. Thanks for your very nice presentation. I have no doubt about the effects of exosomes. I just wonder, sorry for missing the very first 10 to 15 minutes. You might have addressed my question. Does this product contains mRNA,
Oh,
microRNA?
yes. Oh, yes, it does. And we are
Okay,
about to publish actually our data. So, as far as I know, we are the first company to actually do a comprehensive proteomic and lipidomic and RNA profiling study on our exosomes. Because it's
okay,
always easy to claim that certain things are in there, but you want to see them confirmed, right? So, we did just that. And if you have interest in any particular mRNA, I can send you some data. But yes, so they contain all the relevant uh, miRNAs and also messenger RNAs and some others that are relevant to the effect of the exosomes.
okay. So I wonder, given that micro RNAs are not coding RNAs, it does not have any effect on human genome or genomics. But we all know that it could increase some gene expression or the vice versa. So I wonder, it could be a problem in long term. It could create some side effects. So since we don't know the future effects of RNA, so this is one of my biggest concern. I
Mhm.
am using, but I try to avoid exosomes as much as possible during my daily routine. Should we worry about it, or what? What would be your comment?
I very much appreciate you expressing this concern. As a scientist, I also have to agree nothing is ever 100%. Can we be 100% sure that there are not some off-target effects or potential side effects? As I said, like in biology, there's nothing ever 100%. But as close to 100% as it gets, I would vouch for the safety, at least of our exosomes. It really depends on the source that you are opting for. It really depends on the manufacturing standards that a vendor abides by to make sure that these exosomes are safe and harmless. To my knowledge, for exosomes properly manufactured, there have never been any reports of any significant side effects. I'm not aware of any side effects at all. Um, I also regard, when you talk about microRNAs in particular, also long non-coding RNAs that also are a little bit elusive in their exact function. Um, I regard the cell that takes those exosomes up as an autonomous entity that only takes from what the exosomes provide that is needed in that given moment for the cell. Everything else will be sooner or later, discarded by other extracellular vesicles and disappears. So biologically speaking, I don't see the
Mhm.
rationale for or the functional rationale
Mhm.
for any long-term side effects. And we haven't seen any short-term side effects. So I would regard them as safe as they are. But again, I have to stress it. It's really about the source and the manufacturing that is key. And you will find if you look a little bit into what's out there, it is sometimes terrifying of what is offered that is obviously not transparent in any way, where these exosomes come from,
Mhm.
how they have been produced, and so on. And that I would find very disconcerting. Yeah, and I would stay away from that. So I appreciate your concern, and that's why we always encourage our potential customers to ask tough questions. And we will be happy to provide you with our certificate of analysis, for instance, which is some 25 pages long or so,
Mhm.
and goes to show that we actually jump through all the hoops that we find necessary to assure that you get the safest product that's available in the market.
Okay, thank you very much. Thank you very much.
Thank you for the question.
Dr. Hickey, we have few questions in the chat group. The first one is a question about hair transplant.
Mhm,
How you combine the exosome as a hair after the transplant,
mhm.
and beard area which has also uncompleted patches. Can exosome also work for beard areas?
I would argue yes, absolutely. When you do hair transplants, it is a very invasive procedure, and exosomes will not only help with the regrowth of hair, but they will also help with the healing process of after these transplantations. Any uncompleted beard areas that have not been treated are also amenable for exosome treatments. Um, and then it depends on the individual how responsive they are to the treatment. And if you do like a combination treatment with some modality like microneedling or CO2 guns, etc. But the short answer is yes. Please use exosomes. They can never do any harm, I like to say. And I say that with greatest conviction and not just promoting our products. I can say that with scientific conviction that these exosomes that we provide cannot do any harm. They can only do good, and any combination therapy is advantageous.
Great. Um, the second question is how much is the cost of each session? This is probably vary from one area to another. Here in United Arab Emirates, most of the clinics they make the session between 1,500 to 2,500 dirhams. I don't know the person who asked the question from which country you are, but maybe Dr.
Mhm.
Hick, you can give us a range of prices in United States.
I cannot say for sure because it really depends on the practitioner. I can tell you that the exosomes, the way we sell them, are extremely affordable. So if you compare that to other treatments, especially like something like hair transplants, which is really costly, it is almost negligible. So the price for the exosomes as we sell them is very affordable. Then depends, of course, on the dosage that you offer, that you want to use. If you're using 10 billion exosomes, is different from using 100 billion exosomes. Of course, if you are in the UAE, you contact Dr. Haitham, and he will gladly give you some pricing about our H0 exosomes there. And
Probably
if
he or she asked about the cost of the treatment, not the cost of the exosome.
Yeah, as I said, like that really depends on the practitioner, how
Yeah.
much they upcharge to it. And we know of people that are really relentless and want to maximize profit. Others realize that a more modest overhead is more efficient in generating a good customer base. So I really cannot answer that question. You would actually have to reach out to a practitioner offering these kinds of services, or I'm sure Dr. Haitham will get you in touch with his most trusted clients. And if you are from the US, please contact us and we will get you in touch depending on where you are located.
Right. The next question asking about the gap between the treatments. How many
Mhm.
do you suggest and how much time you suggest as a gap?
As a standard, we actually recommend 3 treatments to start with like 4 to 6 weeks in between. That seems like a very good approach, and then once or twice a year. But again, that depends on your age, the severity of the hair loss problems, etc. So it might vary. You can do more treatments, you can do them closer together. And when I say this is actually in combination with microneedling, and microneedling is something you really don't want to do too often because it's also a fairly unpleasant treatment. We have seen a higher frequency when combined with target cool, for instance, a CO2 gun, because it's an easier application. It's pain-free. It seems to be as effective as microneedling, if not more so. And then you can do it closer together until you generate the desired result. And again, after that is maintenance. I mentioned the clinical trials we are engaged in currently, and one of them is just topical exosomes without any adjunct treatment. And there we actually aim to do that every 3 days, an application, something that you can do at home. Again, that would have to be evaluated, and if it works out as we hope, then it's something you can easily do at home as well.
There is a question came to my mind from this question about the number of the treatment. Do you think is there a limit for the number of the treatments of exosome can be applied on a patient? For instance, if one patient liked the result and asked to
Mhm.
come to do the treatment every month, can
Mhm.
do this or there is a limit?
By all means. I mean, there is no really limit. If you do it in conjunction with microneedling, I would advise against it to do it most often. Like I think microneedling, you shouldn't do that closer together than 2 weeks. Please ask your practitioner because it's an invasive and unpleasant procedure as it is. But other than that, as far as the exosomes are concerned, they are safe and you can apply them as much as you want in any dose you want until you achieve the desired results.
All right. Next is what should be ideal protocol for use in AGA androgenic areata, probably androgenic alopecia. How many sessions? How much
Mhm.
ml of solution should be used at a time?
It partly goes back to the question I just answered. Like the ideal protocol is, this package of 3 applications, maybe some 4 weeks apart. Then if you do the volume of the exosomes depends, of course, on the surface area that you want to treat. We found 2.5 milliliters to be an ideal volume to treat the whole face, but you can even minimize that by using like a mister to actually apply these exosomes rather than dropping them on. And then you have a more efficient way of applying those exosomes, and then you just prioritize the number of exosomes you want to apply in one go. I said face because it gives you an idea of the surface. Correspond that to the head. It's probably a little bit more than 2.5 milliliter that you need for the whole head. But if it's just a bald spot, you're probably good with less than 2.5 milliliters.
All right. There is another question. Is it beneficial to inject at intradermal injection junction? Intradermal junction.
Mhm. A very nice question. I'm glad that you asked because as a representative of Resilier, I have to point out that the Resilier exosomes are for topical applications only. The reason is topical application is is considered a cosmetic or aesthetic application, while injection is a medical application, and these are two different beasts for regulatory reasons. But when you ask about the science, is injecting better than, let's say, microneedling plus exosomes? It is arguable. I would think not. Most of these combination therapies are very effective. It's more like a belief system. Some people believe that injection is better. I think if you do microneedling plus exosomes, you have a better surface treatment because the injections are more spotty. But of course, these exosome can proliferate within the skin. So I wouldn't say it's better. It might be equally effective, also depending on a variety of other aspects. But I wouldn't suggest that it's better to inject than topical, and hopefully we'll see that in concurrent studies to be confirmed.
All right. The question after, I think, also has few of these points you just explained. Is American exosome injectable or only dermapen? Uh, Needle depth on the scalp. How much depth you use for? Do you suggest for for microneedling? And how it will keep the effect on age with dihydrotestosterone effect.
Mhm. So injectable, again, Vesalier are topical only. So in the US and also as far as I know in the UAE, you must not inject them. However, our exosomes are manufactured by the parent company Regeneral, and Regeneral is rooted in regenerative medicine. So if you do want to inject, please reach out to us, and we can support you through Regeneral, which is a medical company. The needle depth,
But Dr. Ricky, the
is
difference between, is there a difference in the vial between Regeneral and Resiliel or only the registration?
the labeling is different, the
Only.
registration is different, but
Okay.
the
But the
exosomes exactly.
component is the same.
Absolutely, yeah.
Mm.
So we found it important. So we manufacture them for medical applications. And then we realized that the cosmetic and aesthetics industry is highly interested in exosomes as well. So we offered the same quality of exosomes to the cosmetics uh, field as well. So they are identical in their way of being manufactured and quality tested and validated and characterized. Absolutely. All of them are medical grade. It is just in the US, it's a requirement to strictly separate medical from cosmetics. And therefore, we have two companies. One of them is cosmetics and topical only, and Regeneral is medical, so suitable for injections. But the exosomes are identical.
Okay, needle depth, about the needle.
Yeah, needle depth. I wish Julie Gramick would be here today. I don't think she managed to be on. Otherwise, please interrupt me, Julie. Um, it varies from like zero point 0.2 to zero point 0.5. Again, don't go too deep. Don't be too radical with your needling because then you might inflict more damage on the scalp or on the hair follicles than you would want. Um, I can investigate further if that answer is not sufficient to you and give you like a more comprehensive update on recommendations.
Yeah, all right. And then the last part of the question was about how the exosome can keep its effect along with dihydrotestosterone effect.
Quite frankly, we haven't tested for it, so I would be hard pressed to actually give you an answer. Typically, I don't see any conflict there. You might see conflicts when you apply stem cells, for instance, because they are living entities, and they might have a different way of acting, and they are known to cause certain side effects, most of them mild. But for exosomes, I don't expect any of those. Do you potentially diminish the effect of exosomes? It's possible scientifically, but I don't have any data to support it one way or the other.
All right. Probably because the dihydrotestosterone is one of the reasons of the hair loss.
Hmm. It's possible, and that should actually rescue it. No.
Okay. Uh, in the scalp, could it be injected only or combined with dermapen? I think you
Mhm.
answered.
I answered that question. It can be ejected if you use the Regenerel brand. The Resilier brand is in combination with Dermapen or other modalities only.
Yeah. What was 10 billion and 5 billion? Is it related to the volume of the bottle?
Not necessarily. It depends what territory you are located in. So, for instance, here in the US, we started out 2 years ago, 2+ years ago, by selling 5 billion in 5 milliliters saline. And then we got the feedback from the petitioners that for a facial application, for instance, 5 milliliters is a very big volume. So we cut it. Then we increased the number of exosomes in the vial. So then we started selling 10 billion in 2.5, and that's what we are still doing. Now we introduced actually a multi-vial that gives you like 50 or 100 billion in a given volume in a vial, and then you can always take out as much as you feel like you have to for a given application. That affords the practitioner more flexibility in terms of concentration of your exosomes and the pricing, etc. And it's also beneficial to the patient, obviously. But when we want to indicate a dose, it's always about the number of exosomes that we refer to rather than the volume, because the volume can be changed. You can also take an aliquot out of your 100 billion vial and dilute it in saline. Then you have a different concentration, so a higher volume, and then you have to apply a higher volume to get the same number of exosomes. I hope that makes sense.
Yeah. What should be depth of microneedling with exosomes? I think also we answered this question.
Yeah, I mentioned it before. Typically, what we see most often is, I think, zero point 0.2 to zero point 0.5, but then it depends on the area. Your forehead, the skin is much, much thinner. Under your eye, you have to be very careful. So it's more superficial microneedling. Your skilled practitioner will know best what they typically do for microneedling, and then the exosomes are just subsequently applied topically after the microneedling. So
All right. Okay.
that's the
I have actually two questions. I hear them from many doctors. One of them
Mhm.
is any recommendation to combine with exosome for hair restoration. Do you recommend to combine exosome with anything else to get better results apart from the
I cannot,
microneedling?
yeah, I cannot recommend it. If you have a potent exosome, it's basically all you need. If you do opt for a hair transplant because you want to see the more immediate effect and you want to combine it with exosomes, nothing argues against it, and it will probably be something that boosts each other. Um, we also heard of cases in countries where this is allowed, where they actually combine exosomes with PRP, and they think they see a slightly better efficacy. But there's no data or no study that has really evaluated it. It was probably more that people already did PRP and were like so happy with it, and then they added exosomes and then were very happy with it, with the results. Um, but we cannot know for sure if only exosomes would have done the same trick. So sometimes it's just a preference, or that patients or practitioners want to go all in and want to combine as many things as possible to guarantee a positive outcome. And from the exosomes standpoint, there's nothing that speaks against it. So there's nothing really that would conflict with the application of exosomes. And regardless of what you do or what you don't do, exosomes by themselves are already extremely efficient.
All right. The second question I hear from doctors, because the main interest for doctors is to deliver results to the patient.
Mhm.
A result always a driver for the doctor to nominate which product they use for the patient. So
Mhm.
if we reduce the time between treatments, can this accelerate the result? Like for instance, to do the treatment once a week or once every 2 weeks?
Yes and no. So there is a cycle in which hair grows that, if I remember it correctly, it takes about 90 days or something for a complete cycle to go through it. Then it's age dependent. You've seen the middle-aged gentleman in his mid-40s. He has a different kind of turnover than the 75-year-old. So there are difference in this regard. If you want to assure good results, please feel free to increase frequency. As I said, more is better. We know that much, and then it comes down to assessing price versus um, benefit. So if price is not an issue for you, then you can do it every other day if you feel like it.
And when do you expect that when we should promise the patient that they will see results? They will see result from first session, or they need to wait some time?
Oftentimes, when I refer back to the 75-year-old gentleman, after the first session, he was a little bit underwhelmed. He had hoped for more. He saw some baby hair on the bald spot, but he only noticed after the second session how that bald spot had already decreased. So the short answer is yes, after just one session, you will ultimately see a benefit. Our typical observing time is like 30 days or like 4 weeks, that you wait for 4 weeks and then you compare. And we always unanimously see an improvement. The degree of improvement varies depending on the severity of hair loss, the indication, the age, and the modality that you use in combination with exosomes. So there's variations, but you should see a benefit fairly soon.
Very soon means we can promise after, let's say, the second session. As you said that after
Yeah,
second
definitely.
treatment,
Yeah.
you start to see baby hair.
Yeah, usually after the first already, but it might still be already modest. Again, depends on age and severity and so on. But I'm not aware of anything except for the case that I referenced earlier, where the microneedling was too brutal. We didn't see much of an effect. Otherwise, it is always they come back and have a good result, and then just the degree of the positive result varies on age and severity.
Okay. And another question is, do you do first microneedling and then apply the exosome, or vice versa, or you repeat again the microneedling after? So you do microneedling in the beginning and then you apply exosome and you do again microneedling, or how do you suggest to make the sequence of the treatment?
Just as was proposed, you do the microneedling first, and then you apply the exosomes topically after. You could apply exosomes before and after, but in my book, that would be almost a waste. It's not necessary. So then what the microneedling does, it actually inflicts damage on the tissue and forces the tissue to actually repair and regenerate. It also inflicts microinflammation on the tissue, which is why you have a red face, for instance. And then you apply the exosomes after, which is very effective in also mediating the effects of microneedling. So the redness will go away much faster than it otherwise would. So the recovery and the downtime will be much shorter. Uh, and that is one positive effect. The microinflammation inflicted by the microneedling also kind of activates the exosomes, and because it puts the tissue or the epithelium into overdrive to regenerate, they are more willingly taking up those exosomes and use them to their advantage. So the combination is quite efficient, and it it should be noted, like from a regulatory standpoint, it's also important that you do the microneedling first and then the exosome, because technically microneedling is considered a medical application. And if you mix them immediately, then the exosomes would become a medical application. And since Résilier exosomes are only made for um, topical and cosmetics, that technically puts you into conflict with the regulatory requirements. But this is like regulatory and legal, and then there's the science. Long story short, do the microneedling first and then apply the exosomes after, and you have the most beneficial effect.
All right, sure. And one more thing, there is a claim about exosome that it can regenerate the hair black again. I mean, the white hair in the skull,
Mhm.
it can be regenerated by the exosome black again. Is this
Mhm.
claim is correct and there is a science supporting this? I hope it's correct because I have a lot
There,
of
there, yeah, there's an indication for it. I presented it at this one slide, our patient zero, the 45-year-old, where it looked all overall darker and he had dark hair. And what it does, you really return the hair follicle to a more youthful state. And that includes pigmentation. It's not only about hair growth, but the pigmentation will be remedied as well. We haven't proven it by like high resolution camera yet in a clinical trial. That's also part of what we are doing. But we have any indication that, yes, indeed, you return the color to its normal color. We also see the gentleman in his mid-70s. He used to be blonde and he was now gray and he went back to blonde. So it is strongly indicated that, yes, exosomes can even return the hair color.
That's great news. So I can do a lot of exosomes to return my white hair black again.
Yeah,
That's
you
good.
got a sword. You should.
Doctor, one more question. Because some clinics they are using energy-based devices for hair restoration. When if the doctor is interested to combine the exosome with those energy devices like low light laser or whatever, can they
Mhm.
combine in the same session with the laser, or they should make a gap before or after?
Absolutely, you can apply them together. Just as with microneedling, I would always argue that or advise that you do your procedure that you're interested in and then add the exosomes afterwards for regulatory reasons, but also because it makes sense, because you do something already with the modality that you choose to apply, and then the exosomes will support and boost and amplify whatever benefit you have. And also remedies certain side effects like redness and inflammation that goes hand in hand with these applications. So yes, you can combine pretty much anything. There's no safety issue that I would be aware of. There would be nothing that is ruled out. And I would always advise to do procedure one first and then exosomes afterwards.
Yeah, again, question about the result. And I
Mhm.
appreciate this question because this is the question we are always asked from doctors. And I believe this question is always asked to the doctors by the patient that when we should see the result. I think,
Yeah.
Doctor, you mentioned after the second session. But do you think this is a solid answer we can give to the patient? Like to tell them
Uh,
after second session you
yeah.
will start to see the result?
I think after the second session, it becomes more obvious. You should actually see some benefit after one session already. It depends a little bit on the indication, severity, and age, how well it worked after just one session. So it might be a modest improvement, and then it's about your subjective perception, right? If you have a bald spot and you do a session or two and you still have a bald spot, you might feel underwhelmed, but you should have a closer look about how much baby hair might have regrown, the size of the bald spot, has it diminished, the thinning hair, has it like recovered to some degree. So you should see an effect after just one treatment, after a few weeks, and then it's just a matter of to what degree it has improved. And that also dictates on how many more sessions you might want to take afterwards. But that depends on the individual patient as well as on the modality that you use in combination.
I see. All right. I think it's a clear and it was really nice discussion about hair restoration today. In case any doctor wanted to add any question to Dr. Hiki, you can email him directly on the email mentioned in the screen, which is Michael Hickey at atventurecenter.com. Or you can also reach us or any one of our team to address any question you need, and we will connect with Dr. Hickey to get the answer. Thank you so much, Dr. Hickey, for your time. It was a pleasure.
Always a pleasure.
And thank you for everyone who attended with us today.
It was a pleasure.
See
Thank
you
you
in
for
the next
hosting.
webinar.
See you next time.
Sure, thank you.
Thank you.
Bye-bye.
Have a good day.